system is unsustainable. And I did write an article called The Medical Bubble that I equate to the housing bubble. Because first of all, to me, the foundation, which gets into the what we call non-physician practitioners. I don't call them mid-level practitioners because you also have psychologists and optometrists who want to get into medicine. Also, optometrists who want to do eye surgery and psychologists who want to write for prescriptions now after they take a pharmacology course. Just in, when you're in medicine, you know that psychopharmacology are one of the most dangerous drugs that you can use if you don't know what you're doing. And so they want to write for that, after taking some kind of pharmacology course or whatever. So it isn't just mid-levels that are the issue. It's a lot of people who want to play doctor. And then when the shit goes south, send them to the doctor to fix. Yeah. So now you're in the nice loop where when the lawyer sues, now you're part of that loop, right? So they want to play doctor, they just don't want to handle the complications.
That's the fascinating thing to me, is that these nurse practitioners and other mid-levels that want to practice unsupervised, why aren't their malpractice premiums the same as mine? I don't get that.
Well, that's an issue that a lot of docs have brought up, and one of the things is I don't agree with it. I don't think they should be under the medical board because they're not medical. Just basically, how about you just don't practice medicine? How about that? I don't want them to have that option. And so, but in one state, I think it might have been, was it Oklahoma? It was one state where they just closed up shop and said, forget it. They took it off the shelf because the legislators said, as long as you go under the medical board and you're held accountable by them. And once they put that and made that a condition, they packed up, they said, F it, we'll take it off. We don't want it or whatever. We'll come back later when maybe they have another person who's more agreeable. They don't want to be on the medical board because the medical board will hold them accountable. Nursing boards are notoriously lax, and it's very difficult for them to keep track of that many nurses because they have to keep track of LVNs, RNs, and NPs. That's a huge population for one board. And so there's a lot of people who slip through the cracks, and that's how they're able to practice, outside their scope of practice. But they're not the only ones. Like I said, they're pharmacists who want to do a form of primary care, and psychologists and so on. So that is the unstable foundation, because none of those people have a medical school education that solid foundation that you build on when you go to residency. They don't have that. So teaching them to do medicine by apprenticeship, which is really what's happening, if that worked, we would not have needed a Flexner report. Okay, and the Flexner report came from us having an inconsistent education,
where it came from,
right? So it's like we're just going backwards, and so that's unsustainable when it's on that kind of foundation. You're going to have people practicing medicine who don't understand the fundamentals of it. They just know how to go through the motions. So then, what is the fallout? Well, the patients manifest that damage, right? There's just going to be more morbidity, more mortality, and then that becomes the crash, and then people have to fix that. And so I'm fully expecting that to happen at some point. You can only mask it for so long, but you can't mask it forever. I don't know how long the bubble was in place, but
I just have this gut feeling, if I looked into the future, that what will happen is the technology will develop, the insertion of AI and robotics on the surgical side for sure, where they can guarantee what the results are. I can't remember, you could tell me, Natalie, if it's Loma Linda or whoever first came up, they were the ones that came up with all the protocols that you absolutely had to stick to. And then the physician only interacted with the computerized protocol 5% of the time. I mean, they just followed a rote, heart failure. Okay, do this, do this, do this. Okay, this result, do this, do this, do this. And then
guidelines.
No, that patient's allergic to that. We got to do this. I think that's probably where we'll be 15 years from now. There'll be absolute protocols, and there'll be a lot less of us with the 2 letters after our name.
Yeah, but how are we doing, right? We used to be number one when we were practicing without all this fancy stuff quite like that, right? Now technology has advanced remarkably, and we have so many protocols, it's worse than being in the military. Okay, we have so many protocols and guidelines, which I, of course, don't follow because the patient is my book. Okay, I follow the patient. If they fit the protocol, great. I don't try to deviate because there's good science behind those. It's evidence-based medicine. However, the patients don't come with the book. And if they deviate, AI isn't going to take that into account, you know? And so with all this technology, no one's taking into account the human beings are the ones who are not changing. Matter of fact, they're living longer with more illnesses. So how are you going to address that? Somebody has to create that AI. That would be a human being. That means there's going to be room for error, just like there is with human beings. So no, I don't think it's going to become something we can become completely dependent on. We have one of the worst healthcare outcomes, not only just because of access, but I think because of medical error, because of relying too much on protocols like a crutch. When, we didn't have it at this level back then. Certain areas have improved, like cardiac care, because of tools and, studies. And the other thing you have to consider is, what is this going to do besides technology? What is it going to do about the science, the art of medicine, when people come up with cures and treatments or discoveries? It was doctors who recognized AIDS in the community. They knew they saw something that was compromising the immune system. They didn't know what it was, but they knew that it compromised the immune system because of that foundation of medicine. It was doctors who discovered SARS, recognized that they were seeing something. How do you know if you're seeing something different if you don't know what the norm is? That's the foundation you cannot make up for, and that no AI is going to make up for.